Hello, my name is Dr. Won Kim, and I am an associate professor of neurosurgery at UCLA. I am the co-director of the stereotactic radiosurgery and brain metastasis program. So I'm excited to speak to you today about laser interstitial thermal therapy, or LITT. LITT is a technology that's really taken off within the last 10 years. It's a minimally invasive surgical technique through which a small stab incision we're able to pass a laser probe that we use to destroy abnormal tissue. Now, this can be brain tumors such as glioma or brain metastases, either on diagnosis or after they have failed traditional therapies such as surgery and/or radiation. This can be abnormal tissue that causes seizures or epilepsy. And through this minimally invasive approach, we're able to target and destroy these tissues deep within the brain without having to make large craniotomies as we did in the past. Now, the reason why LITT is so great is that LITT is actually thermal energy that is used to heat up and destroy tissue, so it can treat either tumor or radiation necrosis. It's not like we're adding radiation to a previously radiated field. Now, people might ask, why is LITT special compared to other forms of treatment? And I think I can't stress this enough that LITT is a surgical tool at destroying tissue. It's not radiation, it's not chemotherapy, it's not a drug delivery system, but it's as if we were in there and burning the tissue through an open surgery, but now we can achieve this through very, very, very small incisions and very little downtime. Many of our patients, they come in for a LITT procedure and are home by the next day with a single suture where the laser fiber entered the skull. This allows patients to get back to their normal lives very quickly. It allows them to resume their chemotherapy or anticoagulation that they might need very quickly, whereas traditionally with craniotomies, you would need maybe a week or two to heal fully prior to reinitiating those kind of medications. So this is an example of a LITT case that we did at UCLA where a patient had a radiographically progressive lesion following radiation for a brain metastasis. Now, there's concern that this is either a progressive tumor or radiation necrosis. Instead of undergoing a large craniotomy again, we had two trajectories or two laser fibers placed and burnt this tissue after getting a biopsy in a minimally invasive manner. This allowed us to destroy this tissue, find out what it was, and then get the patient home the next day without any neurologic deficits or prolonged need to stay off his systemic therapy. The yellow lines are transient thermal damage, and the blue lines are permanent thermal damage that occur during the laser ablation therapy. And by measuring and looking at the degree of ablation throughout the case, we're able to see exactly what we're destroying and cover the lesion as much as possible. So you might ask, am I a candidate for laser interstitial thermal therapy? The reality is, if you have a progressive lesion, be it a glioma, a brain metastasis, another form of brain tumor that you know the diagnosis of and it has been treated with traditional methods, there is a very good chance that you may be a candidate for LITT. It really requires multidisciplinary discussion, having a good relationship with a neurosurgeon that performs a lot of these procedures. And I think that's one of the great advantages of UCLA, as we are one of the busiest LITT centers on the West Coast. If you're interested in learning more about laser interstitial thermal therapy and understanding if you're a candidate, please visit our website at the link below.